I'm Moka Lantum. I'm the CEO of Sagitarix Limited. We are headquartered in Nairobi, a Kenya-based company, and our goal is to improve or minimize the burden of morbidity and mortality for diseases, which, in our opinion, are quite common, but not readily diagnosed and treated in rural underserved areas. And so we are squarely focused on providing services that is fair-priced diagnostic and treatment services to these populations in need, making sure that we are picking up the diseases early and that we can treat them in an affordable way through our distribution of hubs located in rural areas. We have partners that include local government as well as suppliers who help us achieve our mission. To date, we have 5 clinics, 1 in Nairobi and 4 in rural areas that have so far serve over 48 villages, of which we have now close to 6,000 hypertension and women and children that we serve on a consistent basis. We particularly focus on the elderly because many of them tend to have hypertension and diabetes, and women because of the ongoing need for maternal and child health, especially for women of reproductive age. That goes in the Kenya setting from the age of as early as 12 years old to 45 years old. So there's a lot of work to do, and we're glad to do that work. The way I look at it is, in other industries, you have promoters, right? Like in boxing and in soccer and in the big championship leagues. But in healthcare, we don't have promoters. And so what I would see innovators in healthcare is that innovators in healthcare is a promoter. But not just a promoter, a great one at it, because they're not billing us for the promoter services. They are creating a lot of value by introducing us to peer companies, so we learn from each other, to introducing us to funders. And so their stamp of approval is everything to what we do, and has meant a whole lot to our ability to grow. Through the innovation process, we were able to refine our business models, and those are not things that take 2 days. It takes 3 years. We've been able to grow from grant-based financing to debt financing and now getting to the equity financing space, thanks to the conversations that have evolved over time with parties that are heavily involved with innovations in healthcare. And we have occasionally used opportunities presented by innovations in healthcare to build capacity. So I've had at least 2 or 3 of my staff join me at meetings or represent me at meetings, which also have presented an opportunity to build capacity. So the way we look at it is they have helped us on 3 key areas: access to suppliers, access to financing, and access to capacity building resources. In addition to the stamp of approval that for what we do, somebody has to listen and pay attention, because we are closing the gaps where governments have not been able to deliver on. And so I think we're very pleased with the partnership, and we look forward to many more years of working with innovations in healthcare. Well, I'd say from the funding side, we are certainly proud that I think right now we have 3 years of a relationship with the Pfizer Foundation. Their funding has allowed us to iterate and reiterate the distribution model for what we now call, social innovation hubs, where we're able to use technology, supply chain, and service delivery to make it work in rural areas. That work could not have happened if we didn't have the funding from the Pfizer Foundation. We've also had the opportunity to now engage with the Medtronic Foundation, and that contribution has helped us to improve our data excellence. Data is the new oil, right? So it's not only important for decision making, but very critical for long-term the strategy of the company. So that's great. We've had great interactions south-south between ourselves and other innovators. It doesn't make the news, but we learn a lot from each other. You can name it SevaMob, Mobile Access Mobile. I take a lot from the company out of Singapore, CXR, and so we learn a lot from each other, either even from the newsletters or from hearing others speak, and that's why we're excited to be at the meeting here in Washington. Well, we are looking forward to many more years of collaboration. We believe that now it's time to start harvesting the fruits of the work, the foundational work that has begun. So our hope is that from this meeting and the engagements that we expect to happen, that we would sort of move the conversations now from the innovator mindset to the scaling mindset. That requires unlocking a very different kind of resources, very different kind of commitment. Whereby we should start thinking about really enhancing the transactional activities that are happening within the network of ventures, if you will, in the network. So I think that's what would excite us. A company that is now 8 years in business, where we are no longer looking at the fundamentals in terms of what your idea, what your impact strategy, or what we know who we are, we know what we do. Now it's a matter of like, okay, how can we mobilize resources that can take us, de-risk our business model and take us to the next level of scale. So it's a very different set of conversations that we are interested in at this phase of growth, and certainly we show that innovations in healthcare can give us some insights and some new directions in terms of what we could do better and differently, or bigger, if nothing else.